What's up, fitness fam? Welcome back to my channel, or to my channel if you are new. Today I've got a very special guest coming in, and I'm so excited for you to meet Michelle. She is my wellness specialist. Amazing person. She's had a journey of her own. Check this out. She's lost 60 pounds herself. She started at age 45. She's now 52. So she gets it. She understands what we go through as we get older, the hormonal changes. She's been doing, specializing in hormones for many years, and she does telemedicine. I've got all her information below. Don't forget to like, comment, subscribe to my channel so you never miss a good video. I've got some good ones coming up. Also, during this video, as she's talking, I'm going to be flashing some screenshots for you. So pause the video when you see those, screenshot them and save them to your phone because they're going to help you tremendously. It's really important that you understand what's happening to your body, why you can't lose weight. You're not crazy. Your hormones are. That's what Michelle will tell you. So definitely screenshot those as they come up. Also, Michelle has an ebook out, which is really helpful. I will have it on my website. She will have it on her website. Info is in the description below. Definitely worth the money to have that ebook. It's phenomenal. So without further ado, I cannot wait to introduce you to Michelle. Here we go. Hey, Michelle, I'm so excited that you're here with us to talk about hormones today. Oh my gosh. I know the ladies watching are probably have a ton of questions too. But I think the most important question is, which one of these dreaded ass hormones causes the belly fat? So let's get into that mess.
Okay, so there's several hormones that affect belly fat, but one of the biggest ones that most women are concerned about is estrogen. When your estrogen is low, you hold on to belly fat. You hold on to fat in general because when your estrogen is low, your brain wants more estrogen. Fat cells make estrogen. So your brain says, hold on to all the fat you have so that we can make more estrogen. So besides estrogen, there's a few other hormones that affect belly fat and weight loss. One of the huge ones is insulin. People don't realize that insulin is a hormone, and insulin makes you store fat. Another one is cortisol. Everybody knows about cortisol. There are two hormones that have really funny names, leptin and ghrelin. I usually call it gremlin because it's the hormone that makes you say you're hungry. And leptin says you're full. Then there's growth hormone. Growth hormone affects your appetite and your metabolism. And then, of course, testosterone, even for women.
Wow. Yeah. We just have so much wiring in our bodies, right? I mean, just, one wire blows, the next one goes, I tell you. So which one of these wires or hormones causes hair loss? That's what I want to know.
So a lot of people are going to be surprised about this one because a lot of people associate testosterone with hair loss. And it does cause hair loss, but it's more male pattern kind of hair loss. So the receding hairline, the bald spot on top. But the biggest hormone that affects hair loss is cortisol. So when your cortisol levels are high, you lose your hair. Another one that is affecting hormones, or a hormone that affects your hair loss, is thyroid. And that can be overactive or underactive thyroid. It's not just hypothyroidism that causes hair loss. Both of those cause hair loss. When you don't have enough estrogen and progesterone, your hair growth slows down and each one of your hairs gets thinner. So even though you're not losing hair, it's causing you to not grow as much hair and your actual hair gets thin. Growth hormone, if your growth hormone is low, it's called growth hormone. So it helps you grow your hair. And one thing that is not a hormone, but affects your hormone and affects hair loss is severe rapid weight loss and very low calorie diets. Those are not good for anything. Your hair is not essential for life. So your body is going to take all the nutrients that it normally gives to your hair and put them somewhere else that actually needs it.
Wow, so cool. All right, so next one up is testosterone. A lot of women don't know this, that we do have natural testosterone in our systems just like men do. It's really interesting. I didn't know it even in my early years, of course. But what can be the symptoms of low testosterone and how does that affect the body?
So everybody knows some of the effects of testosterone. It increases your sex drive. which is important for a lot of things, but it also affects your ability to have an orgasm, which if you're going to be having sex, you need to be having an orgasm.
Right. True.
It also increases your muscle mass and your muscle strength, which is also going to help your metabolism. So testosterone helps your metabolism. Testosterone helps you sleep. That's actually how I know when my testosterone is getting low, is I'm hitting my snooze button 5, 6 times. And normally I'm up before my alarm ever even goes off. Testosterone, if your testosterone is low, it can cause depression and anxiety. A lot of people, when they go on testosterone, will either lower their doses of their antidepressants and anxiety medicines or come off of them completely. A lot of people do not know that testosterone, if your testosterone is low, it increases your risk of breast cancer.
Oh, wow.
People don't normally associate breast cancer and testosterone, but they've done studies that when you have low testosterone, your risk of breast cancer is actually higher.
Wow.
And the biggest thing that testosterone does that nobody knows it does is it builds bone density.
Yeah.
So you only build bone until you're about 32, and then you lose it every year after that. When you lose your estrogen, that bone loss accelerates. When you take testosterone, your bone density actually increases about 8% every year that you take it. So there's a lot of things that testosterone does. It's not just so that you can have a sex drive.
Okay, so this is something I'm curious about. What is the most common thing that you see as a wellness specialist when your labs come back for, all the women that you've worked with?
So the most common thing I hear when the women and men come to me to have their hormones checked is they won't check my hormones. I can't get anybody to check my hormone levels. Not just that they don't know how to treat them, they won't even check them. So then when they get their hormone levels back from their OBGYN or primary care, they say, your levels are normal. You're fine. Well, hypertension and high blood pressure is normal when you have kidney disease, but we still treat it. If your hormone levels are normal, but you're still having problems from it, then we treat your hormone levels. And the other thing that I hear a lot of times is I don't want to take hormones because they cause cancer. Hormones do not cause cancer.
Yeah.
Artificial hormones increase your risk of cancer. Bioidentical hormones do not increase your risk of cancer. If they did, you would have been having all of these risks your whole life because you've been making these hormones your whole life. Another one that I love is you're not having any signs and symptoms of menopause, so you don't need hormone replacement. Well, here's a newsflash. We are not just our uterus. Estrogen, progesterone, testosterone protect your whole body, your brain, your heart, your bones. They prevent blindness. There's so many things. So I hate hearing that if you don't have hot flashes and night sweats, then you don't need anything.
Oh, I hear that too, sis. Okay, so next question, and I know a lot of women are curious about this. What are the age ranges from the start of perimenopause all the way up to menopause?
Okay, so there's perimenopause, and peri means around. So it means you're not in menopause yet, but you're working on it. So that can actually start as early as your 30s.
Oh, wow.
That's not common, but it can start that early. The usual age where you start to go into menopause is your early 40s. And that is when you're still having periods, but they're sometimes 40 days apart, sometimes 15 days apart. Sometimes you hardly have any period. Sometimes you go to the bathroom and feel like you birthed something. When you're actually in menopause, then that's usually the average age for women is 52. So it can be before that, it can be after that. The technical definition of menopause is you haven't had a period for a year. If your FSH level is over 23, then that means you're in menopause. One thing I absolutely hate is somebody says, I'm done with menopause. You are never done with menopause. And they think that they're done because they don't have hot flashes and night sweats and vaginal dryness anymore. But that's actually not a good thing. That means that your brain has been trying to tell your body to make more hormone, and that causes the hot flashes and night sweats to get your attention. It's like, hey, listen, I don't have any hormones. But when you stop having the hot flashes and the night sweats, it's because your body gave up. So that's not actually a good thing. Your body's not responding anymore.
So awesome. This information is awesome. Okay, so next question. What are the most important vitamins to test for? Obviously D3, B12, iron, those kind of things. So maybe explain a little bit about those and how it affects the body when you're low on each one and yada, yada, yada.
Okay, so that is actually a very good question because vitamins and minerals and things like that affect your hormone health. D3 is one of the most important vitamins that you can check. Most people have no idea all of the things that D3 does. 70% of your immune function comes from vitamin D. The optimal level for vitamin D is much higher than what the lab says that it is. So to improve your immune function and to help with weight loss, which vitamin D does also, your vitamin D level needs to be between 50 to 80.
Wow.
The cutoff for the lab is 30. Well, 30 is just a cutoff so you don't get rickets. It's not the goal of vitamin D. We want optimal health. So vitamin D, most people need 5,000 to 10,000 units a day to get their vitamin D level up over 50. Vitamin D also affects your gut health. And as anybody who's ever talked to me knows, your gut health is everything. You cannot lose weight. You cannot get your hormones under control if your gut's a mess. So vitamin D3 will help with your gut health. D3 also helps with depression. That's one of the first things that I check if somebody has depression. B12 is another one that's important, especially if you're trying to lose weight or for your hormones. B12 affects your nerve function, which is also important. Vitamin D and B12 are needed for your thyroid to function properly. Yeah. And most people don't associate vitamin D and B12 with your thyroid. Vitamin D, everybody assumes, is just your bones. And your bones are just one of the things that vitamin D takes care of. Wow. One of the other things that I always check for, it's in my regular panel, is a ferritin level. And that's an easy way to check your iron level. It's a type of iron. If your ferritin level is too low, you are tired. That's when you get the iron deficiency anemia. So you're not just tired like you want to go to sleep. You're physically tired because you can't get enough oxygen to your muscles. So when you're working out, you're just like, I just can't go anymore. And a lot of times your ferritin level is low. Another thing that happens when your ferritin level is low, and I'm not going to get into too much detail with it because that's a whole other subject, is when you have low ferritin, your body will make more reverse T3 than T3. Oh, wow. And T3 is the active form of your thyroid hormone. Reverse T3 sticks to that same receptor that T3 does. So you have plenty of T3, but it can't get onto the receptor because the reverse T3 is stuck to it. So when you have low ferritin, you're making more reverse T3. And reverse T3 can sometimes take years to reverse back to a normal T3 and get off of your receptors. So those are usually the three nutritional things that I check on lab work.
Wow. I'm so glad we did this. This is so fascinating. All right. I'm learning more and more and more every time I talk to you, girl. All right. So the next question I have is about pellets. So I know there's so many different, therapies that you can do with hormone therapy. There's creams, there's pills, there's pellets, there's shots. I'm kind of a control freak, so I'm not a huge fan of the pellets just because I would rather just control it a little bit more for me. But I know a lot of people like them. So let's touch on that and talk about some of the therapies, including pellets.
So I know you don't like pellets, and that is perfectly fine. There are so many different kinds of testosterone therapy. And it's kind of like what you say about exercise. The best exercise is the one you'll do.
Right.
So if it works for you, do the one that fits your budget, fits your lifestyle, and works for you. So pellets are great. They're bioidentical. Actually, almost every testosterone available is bioidentical. Most people don't know that.
Interesting.
But the pellets are bioidentical, and they're just like the size of a little Tic Tac. They make a little cut. It's this big on your hip, the upper part of your hip. For women, it's about every 3 to 4 months that you need a pellet. For men, it's about every 4 to 5 months, depending on how active you are. And that is actually the main difference with pellets and the other forms of testosterone is they're not time released. They're released based on your cardiac output, which is how your body does it. So when you have increased activity, your ovaries or testicles say, hey, we got more blood flow. We need to get more testosterone for her or him. So that's how the pellets are released too. You have increased blood flow, increased cardiac output, and the pellet releases the testosterone. So that's why the pellets last range depending on how active you are. But they're expensive. They're like $350 for women, $700 for men because they get so many more pellets.
Oh, wow.
And so a lot of people can't afford that, and that is perfectly fine. Or they don't want that little cut every 3 months. So if that doesn't work for somebody, don't do it. There's oral testosterone, which I never use. I know that they are coming out with some testosterone that doesn't do this, but most oral testosterone, because of the first pass effect in your liver, most of the testosterone is completely metabolized out. So you don't get a lot of it, and it's hard on your liver. So I don't normally prescribe oral testosterone. There's testosterone creams, which have to be compounded. They're generally pretty inexpensive. Insurance does not cover any compounded medicine, so you have to pay cash for them.
Oh, wow.
If your testosterone level is not too low, then you can get away with doing a cream because you rub it on the inside of your forearm once a day. If your testosterone level is less than 3, you have like 1 or 2 testosterones in your whole body. You're going to have to slather that all over your whole body to get your testosterone level up far enough. So it's just not convenient or cost effective to do it that way. The easiest and most least expensive, I should have just said least expensive,
Least expensive
is injections. And just like you said, they're easier to control. You can increase your dose up or down depending on what your level is. So the testosterone injections for men, they usually do an injection twice a week in their muscle. For women, they usually do a teeny tiny bit of testosterone once a week, and they usually do it subcutaneously because that slows down the absorption of the testosterone so that they can only do it once a week, because it would be really hard to do it twice a week with that teeny tiny dose. It would be hard to split that up. Testosterone a lot of times is covered by your insurance. And if it isn't covered by your insurance, the vial, like a 1 milliliter vial of testosterone, is like less than $20 with GoodRx. And that vial lasts like 6 months.
Wow.
So it's super inexpensive. It's bioidentical, and it's easy to regulate your dose.
Interesting. So what about estrogen though? Like when you do your estrogen, what are the forms that you can replace with that?
So with estrogen, I never use, I seem to be biased against orals, but I'm really not. There's reasons. As oral estrogen tends to metabolize into compounds or forms of estrogen that actually increase hot flashes and night sweats, which defeats the purpose of taking the estrogen in the first place. So I don't normally use oral estrogen. There's also estrogen cream, which, I do a lot of. That's my favorite form of estrogen cream. There are 3 different types of estrogen that your body makes. There's estradiol, which is the dominant one. There's estrone, which is actually increases your risk of cancer and causes more of those side effects of high estrogen that you think of, like nipples hurt, you're crying about Downy commercials, cold water. Don't judge. That's an actual real life experience.
Yeah, I know. Right?
So estrone causes more of those symptoms. Plus, it increases your risk for reproductive cancer. So you produce more estrone than estradiol as you get older and get to menopause. So nobody in their right mind would prescribe estrone. Then there's estriol, which is a very mild form of estrogen, but it's protective. It actually protects you from reproductive cancer, and it balances estradiol, because estradiol is kind of a bully. So it's like the mom and the dad. The dad's throwing the kid up 20 feet in the air, and the mom's going, could you please not do that? So you have estriol balancing the estradiol. So the cream that I use is 80% estriol and 20% estradiol. And it's a topical cream that you use once a day. There's injectable estrogen, but that is just estradiol. And if I can get away from using just estradiol, I try not to.
Gotcha.
We can always balance the estradiol with progesterone, which also is more like the mom. So progesterone is a pill. And it's actually bioidentical and available at a regular pharmacy. You don't even have to get it compounded. So it's super cheap.
It's good shit.
Yeah. I try to always know how much stuff costs, because if it's too expensive, people aren't going to do it. And they're going to be afraid to tell me that I can't afford that.
Right.
I didn't get it. So I always tell cost is important no matter how much money you have.
Yeah, exactly. I agree. Okay, so another question, what is the cost of all of this? You know, a lot of ladies ask me, does she take insurance? You know, what's the total cost of all this? What are my meds going to be? And, you know, all that good stuff. So, and also I'm excited about your ebook coming up. Some of these screenshots that we've got up here that I've told these ladies to screenshot is super helpful information, but the full ebook will really help these ladies a lot too.
So like I said, I'm always conscious of cost of everything. Everything that I do is telehealth, because hormones are basically based on your symptoms and how you feel. And I don't need to physically touch you to know that. I can look at your labs, ask you questions, get a history. My fee for my visits is $90. I do not take insurance for my part of that. So I'm only cash for that, because that's how I keep most of my costs low, is I don't have to deal with insurance.
Yeah.
However, you can use your insurance at the pharmacy for your medications, because I just send your prescriptions to regular pharmacies. You can either go pick it up like CVS, Walgreens, Walmart, whatever, use your insurance. A lot of the things that I prescribe are relatively inexpensive if you don't have insurance, even using GoodRx. And I usually know about what the price is on GoodRx for the things that I prescribe. Like I said before, compounded hormones are a little bit more expensive. The two online pharmacies that I use a lot, for instance, a 30-day supply of the Biest cream, the estrogen cream, is about $30 to $40. So it's not super expensive.
Yeah.
Some compounding pharmacies are super expensive. So I tell people to shop around, because I had a lady tell me that a 90-day supply was $427.
Oh my gosh, wow.
There's no way it should ever cost that. So you can also use your insurance for lab work. So when I order labs, you can go to LabCorp Request and use your insurance there. If you don't have insurance for lab work, then there are some discounted panels that I can do that are pretty inexpensive, like $130 for women and $150 for men. And that's for like 12 to 13 tests. So it's a pretty good panel.
Oh, that's awesome. Okay, so I want to talk about your journey because you've lost 60 freaking pounds. Like, and you did it just like me at an older age. You started at 45, I started at 42. And I think that helps a lot of women understand that they can do it no matter how old they are. And I say that all the time. And I think sometimes they think I'm full of it, but it's so true. I mean, you can start at any age. And I think your journey is amazing. So I would love for you to just kind of touch on that for a moment.
So I definitely gained weight when I was in my mid 40s. And just for a little background, I'm 5'11", so I could hide it well. But when I graduated from high school, I was 5'10". I weighed 116 pounds.
Oh, wow. That's tiny.
I was this wide. I could eat anything that I wanted. So it wasn't like I was always overweight. It was hormones and menopause and getting a divorce and all these things that life throws at you. And all of a sudden, I weighed 198 pounds.
Oh my gosh.
And I was just like, why didn't somebody tell me I was getting fat? My face was round. And I'm like, why didn't I notice I was getting fat? But
Same.
It creeps up on you.
It does.
So I got on the scale for a physical one year and I was about 45 and it said I weighed 198. And I had always, most of my adult life, weighed about 140. I didn't usually go over 140. So I got on the scale and I said, no, I don't. I started bawling.
Aww.
And I said, okay, so I need to do something about this. So that was when I started researching hormones and vitamins and things like that. And I got on testosterone. I started probiotics, which is one of the hugest things that you can do if you're trying to get your hormones in check and lose weight. I started keeping track of every single calorie I put in my mouth. Even if it was just a bite of something, I kept track of it. Eventually, I knew how much I could eat and I didn't have to keep track of stuff anymore. So I got down to about 170. Oh, and that was over about 7 or 8 months when I first started. And then I was kind of stuck at the 170. So then I started increasing my exercise. And all I did was push-ups, sit-ups, squats, lunges, things that I could do with my own body. When I was at work, I worked in a clinic that was in a grocery store. So I used to go get those big jugs of Tide, and I would use those for weight while I wasn't seeing a patient.
Whatever works.
And so I just walked more and did more of those exercises, continued not eating like an asshole.
That's right.
And then I got my hormones more in tune, started more vitamin D, and now I weigh 138.
Wow, girl, that's just so amazing. I'm so impressed, really. I mean, we all have a story, really, but to hear you say it and then your journey too, you know, I think a lot of women don't necessarily give up on themselves, but like you said, it just creeps up on you, you know, the weight does. And before you know it, you're up 10 pounds, 20 pounds, and how'd this happen, right? So I want to thank you so much for coming on to my YouTube today. I'm sure these ladies will get a lot of knowledge out of this. I hope you ladies screenshotted some of the information above, but definitely check out her ebook as well that we have on my website and her website as well coming up. I'll put all the information below on where to find it.
Well, this has been really fun. And this is actually, as you know, pretty much how my consults go.
Yeah.
We just talk like we're having a conversation. I tell you all this stuff that's in my brain and hopefully not overwhelm people. I usually email everybody the stuff that we talk about on our consults because I say a lot of stuff and a lot of this stuff is new for everybody. So I really just want to help as many people as I can with all of the information that I've learned through my own personal experience and through being a nurse practitioner for 23 years. And if you guys need any help, just message Claire and she'll get you in contact with me.
You bet I will. All the information is below. Definitely will check you out. Thank you so much for coming in today. I'm so grateful, girl.
Thank you.
Wow, right? Michelle is a wealth of information. That was just super, super educational for me as well to learn a little bit more detail about some things. Because, like I've always said, I'm not a doctor, but I work closely with Michelle, so I've learned a lot from her for sure. And if you need her information, I'll put it below in the comment or in the description. So just make sure when you email or text her that you say you saw this video so that she knows where you came from, all that good stuff. And I hope you enjoyed this YouTube. Let me know what you would like to see next. And once again, thank you for watching.